Well, welcome everyone. Thank you for joining us today for our webinar on community colleges and health navigator programs with our featured presenter, Erin Perrin. She is the author of the new book, Principles of Health Navigation. My name is Sophie Teague, and I'm the Senior Marketing Manager for Public Health and Health Administration here at Jones Bartlett Learning. And for those of you who are not familiar with Jones Bartlett, we are a provider of instructional, assessment, and learning performance resources for the secondary, post-secondary, and professional markets, and we specialize in the areas of health and safety. And then finally, I wanted to let you know, I'm about to introduce you to our presenter, Erin Perrin, but I did also want to let you know that we have Dr. Richard Riegelman in our audience attending, and some of you may be familiar with Dr. Riegelman. He's the founding dean of the Milken Institute School of Public Health at George Washington University, and he's been very much involved in the community colleges and public health certificate initiative between the League and ASPPH. And if you have any particular questions for him, he will be available at the end during the Q&A session to answer questions along with Erin Perrin. So now let me introduce you to Erin Perrin. Since 1990, Dr. Perrin has held faculty appointments at the University of South Florida College of Public Health in the Department of Community and Family Health. Prior to obtaining her PhD, she worked as a registered nurse in a variety of public health clinics and hospital settings for over 15 years. Currently, Dr. Perrin is an associate professor. She's also the interim associate dean of academic and student affairs and the assistant dean of undergraduate studies at the USF College of Public Health. And in that role, she oversees all aspects of the newly approved undergraduate degree, which is the Bachelors of Science in Public Health. Dr. Perrin teaches both undergraduate and graduate level courses. Her research focuses on adolescent health with a special interest in teen pregnancy. Dr. Perrin also serves on several community boards in the Tampa Bay area, and she is the author of 3 textbooks from Jones Bartlett Learning: Essentials of Planning and Evaluation for Public Health, Principles of Evaluation and Research for Healthcare, and then Principles of Health Navigation, which just published in September as part of our new Health Navigation series. So with that, I will now turn things over to Erin Perrin.
Good afternoon, everyone. Thank you so much for attending this webinar. I really look forward to doing these. We did a few for the other books, and so first and foremost, besides thanking you for coming to the webinar today, you will find at the end of the presentation is my email address. And if you think of questions after the webinar or you would like further information 1 or 2 weeks from now, you can certainly email me at any time and ask about what you're thinking of, asking questions, and I will respond as quickly as possible. So feel free to communicate with me at any time. So let's get started. First of all, I just want to give you a little bit of background as to where we are with the undergrad degree, both at the community college and at the university level. This graph from the Association of Schools and Programs of Public Health shows the dramatic change over since about 2003 until the current of how the programs have changed from the Masters in Public Health, the MPH, that has been around for years and years and years, and now it's moving to the graduate level. The next slide shows just the distribution of that around the United States, but what I really want to focus on is where is all of this in relationship to the community colleges. The growth in the community colleges has not been exactly the same in majors or minors in public health, and as Sophie mentioned, Dr. Riegelman is on the phone with us today. He'll be available to answer questions at the end, but he has worked tirelessly with the League of Innovation in Community Colleges, along with the Association of Schools and Programs of Public Health, to really endorse not only public health, but the health navigation degree at the associate level. And you'll see that there is a lot more information regarding the League exclusively for community colleges at that website that's on your screen. The other thing I really want to mention at this point is the fact of health navigators. You know, everybody says, what is this? What do they do? Where are they going to get jobs? So we're going to delve into that a little bit today, but we're also going to be thinking that this could be not only perhaps an associate degree in your community college, but it might also be a certificate program that is overlaid on allied health programs, nursing programs, various and assorted tech kind of programs. There are lots, as you see on the slide there, over 100 job titles, that's the good news, and the bad news is there's over 100 job titles, which leads to some of this confusion, which is why Jones and Bartlett decided that we needed to have an umbrella topic, and the umbrella topic is health navigation. It could be community health worker, it could be patient navigator, it could be health insurance navigator. There are just a host of different geographical names. What we call health navigators in Florida may be what is a different topic than what Idaho or Washington uses. So when we begin talking about this, it is whatever is the common phrase or technology that's used in your particular area or city or wherever you're at. There are new funding sources, thanks to the Affordable Care Act, that health navigators are getting not only some recognition for signing people up for the ACA programs, but also hospitals are really looking in depth at the readmission rates, and that is costing hospitals thousands and thousands of dollars for the 7 diagnoses that if the person, usually the elderly person, is readmitted within 7 days, there are penalties with that. So that leads into, okay, what can community centers do? What can home health people do? And so it all falls under that big umbrella of health navigation. I also want to show you this slide, a little bit small, but just to see where the impact of the health navigation is. Increased screening. If you are a home health navigator, then you're going to be talking to your clients, patients, the families that you're working with about screening, improving and confirming the testing has increased. This could also be if the health navigator works in a hospital setting, make sure on follow-up, those kinds of things. My favorite little X on this entire thing is improve client satisfaction. You don't have to go past the person sitting next to you to hear stories of health care and problems getting appointments, problems getting payments, co-pays, and all the soup of technology that we have. So if anyone can improve client satisfaction, that would be a bonus for the healthcare system. Healthcare providers are satisfied to a limited extent. But there again, if it makes their job easier, then that is only going to go from limited to moderate to strong, because they'll start to see the benefit of having someone in their office or a busy clinic to kind of come behind the nurse, not to replace the nurse, but to go behind the nurse to make sure that the client is getting exactly what they need to be compliant, because none of us want to either be involved with or be the patient that is non-compliant, which may not be the real term of non-compliant, but it may be a transportation issue, it may be a literacy issue, and we'll talk about that a little bit later. So we'll continue on to get into the meat of the book. Jones Bartlett has a 3-series of health navigation. The first one, as Sophie said, came out in September, and the 2 remaining books will be out shortly in the spring of 17. So if you're putting together a health navigation certificate or perhaps a degree, a major, or a minor in your community college, you will have the tools by the spring of 17 to really have a package to give to students so that they've got books to look at. Because if you look for other books online, you'll see that there's not a lot written out there about health navigation. We also have the health navigation blog. We've done that. It started back in 2015, sort of introducing the idea of what a health navigation career might look like. We were doing the blogs while I was writing the book, mostly to get people's input, and then I incorporated a lot of what I heard back on the blogs into the book itself. So that really did help. If you participated in the book or in the blog, you might have also participated in the book. So this is an overview. This is the Principles of Health Navigation, comprehensive overview, and the initial market is for community colleges, and like I said, not all community colleges have any degrees, even a minor or a certificate in public health. So you layer that on top of nursing, allied health, health science, so that they get an overview of maybe this is a career that I could go into as a starting point, because certainly the role of health navigators has a career path which could lead to nursing school and on up the path through nursing or through the allied health. So that's kind of what we were going for with the book. So the first portion of the book is introducing the student to healthcare personnel. And this is a very comprehensive list, not just doctors and nurses and techs and phlebotomists, and it goes into every single possible healthcare career, looking at the Department of Labor website, looking and really digging into so that they really understand that there is a wide variety. Then the first part of the book talks about, well, I'll go through the 4 parts and then we'll go into each one a little bit in depth. Prevention and community health. That's where health navigators can really make their mark. It's all about prevention. It's so much easier to prevent diabetes than it is to treat it. It's so much easier to prevent anything, we know that in public health, than it is to treat it after the fact. So it gives students an introduction of why this is so important. Then we go into what is healthcare and the ever-present soup of acronyms of health insurance. Then we go into what does it take to care for an individual person. So we go from sort of the community level down to the healthcare, down to the actual individual, and then part 4 is really looking at health information, which is so important if you're going to improve compliance and understanding, is where do people get that information. So health navigators, to give you kind of an overarching view, what do they do? Well, they're the folks that have time to listen. They're not the doc, they're not the nurse. They may actually spend time in the waiting room. They may talk to the person after the visit, before the discharge, before the test, those kinds of things. They try to make sense in the language that is appropriate for the client, at the literacy level that is appropriate, to increase compliance through understanding. You can't be compliant if you don't understand. It's like you can't pass a test if you were never given a syllabus on what to study. It's the same type of thing. Improve health communication, and then to serve as that liaison between the complex healthcare system and what it means and what it's going to take for them to feel better. So let's go into part 1. This is where we start talking about preventive health care across the lifespan, not just for the elderly, not just for the geriatric patient, but where is this across the lifespan? What is the stress level of the working parents with little kids? You know, what's the health of the little kids in the daycare that they go to? So we look at the whole thing across the lifespan, looking at the traditional public health, primary, secondary, and tertiary, and where does that fit into the role of the healthcare navigator, but also the health of the patient across a lifespan? Then, because this is a community college level book, we look at things like the role of public health institutions. What is public health? The federal level, the state level, and one place where health navigators will be extremely valuable is in preparing for disasters. I live in Tampa, Florida. We're always looking at hurricanes. If you live in the Midwest, you're looking at tornadoes. If you live in the West, you may be looking at forest fires. These folks could be very valuable for places like the Red Cross and working full-time there. Part 2 starts out with what are the inpatient services? So we go, these are a couple of examples, but there, as we all know, there's many kinds of hospitals, there's many kinds of residential care facilities, so more of an in-depth look at all that. The other thing to remember is that each of the chapters includes a minimum of 1 and sometimes 3 or 4 examples and case studies. And these case studies really try to bring the text of the book into how is this going to look for a health navigator? What is this going to look like? And the case studies have questions at the end, and sometimes the case studies are broken up into 2 or 3 parts across the chapter. As they're being introduced to new terms, we bring the case study back and include things on that particular topic. Then the second part of that chapter is looking at outpatient healthcare facilities. What is a wellness facility? What's outpatient? What's private, group, corporate? Introduction to all of this. These are either over the traditional age, going back to a community college for a degree. They might have been a certified nurse assistant for a while. Now they're ready, their kids are older, they're going back to become a health navigator in a 2-year program, or they may be students coming right out of high school looking at how they can get into the healthcare system. Different types of clinics, different types of pharmacy, and then outpatient ambulatory care centers. So we cover and introduce all of that. And then the last part, or the middle part, I guess, of the second part is to look at health insurance. And on a daily basis, everyone is struggling with what is a copay, what is out of network, what is in network. And I don't know about the rest of the country, but here in Florida, we don't have copays anymore. We now have co-percents. That's a new thing. So you don't pay $25 anymore for a co-payment. You pay maybe $37.52 because it's now a co-percent. So that's not in the book. That's a new thing in Florida. So we are constantly changing and needing to know what is the terminology of healthcare in the United States. The last part of this is starting to look at the quality and just to give them a high-level overview of what are some of the regulatory agencies. They may hear about, if they work in a hospital, what the Joint Commission is. What is quality assurance? If they're involved in a university-type setting, they're going to hear about research that's going on. They need to have a basic idea of what institutional review boards are. Of course, they would not be licensed to be getting consents, but an awareness in case somebody asks them is what we're shooting for here. The third part gets down to the individual level. I really want health navigators to listen to the stories of people so that they get a sense of what exactly do these people need, where, you know, they may be refugees, they may be migrant workers, and to get the whole not only the life story, but also the social and cultural norms of the person that they're trying to help with literacy and looking at health disparities and how to read electronic medical records, how to help the person get their lab results, all that sort of tell me your story and then I can help you kind of emotional connection with their patients or their clients that they're working with. Then we go into a brief discussion of the difference between infectious disease and the role of immunizations and vaccines, followed up by non-communicable disease, heart disease, all of the things that we work with now, COPD and diabetes and all of the other chronic diseases that we're working with on a daily basis in healthcare. And that section wraps up with having them really look at quality of life issues and becoming comfortable, maybe even among their own family, to know what healthcare decisions are all about and what end-of-life care is all about, including hospice, or for those who don't choose hospice, what will that look like? So the fourth part of the book is assessing information, a large section on not only health literacy, but do they understand numbers and calculations, and how do you develop health materials at the literacy level, looking at visuals, looking at, you don't put a picture of a heart that is outside the body. People don't know the location of major organs. So just those kinds of details. What is customer service? And how do we give that? How do you create a positive environment? And then lastly of that section is patient responsibilities and also the responsibilities of the healthcare provider, including the health navigator. The next section looks at how do you access health information. I think in today's world, people just think, well, if I have a smartphone, I'll Google it, and I'm going to look at WebMD, and then I'm going to understand it. Well, it's not that easy. We know that. If you're on this call, you know that. So how do we help people to navigate this? Some of our clients may only have internet access at a local library. So that may be where they're getting their information. The literacy level of WebMD is a sophomore in college. So looking at WebMD may not answer any questions at all, and in fact it may just lead to more confusion and more distress, because a little bit of knowledge makes healthcare really scary. So hopefully that's where the health navigator can bridge the gap between, be the liaison between the healthcare provider, the nurse, and the patient, saying, you know, English is this person's third language. Maybe we need to step back a little bit and look at some of the things that are going on in this person's life that may make this a little bit more difficult than what we're thinking of on a daily basis, and being very cautious of what websites are out there. Are they trying to sell you vitamins? Are they trying to sell you magic potions that's going to cure whatever ails you? Or are we really giving people government websites, CDC websites? There are websites that are lower literacy and still give accurate information. So those are other good suggestions that the health navigators would look at. And then looking lastly at the health information for clinical practice. So what exactly is the information that's being given? Does the person understand their health diagnosis and treatment? Do they understand the information of how to prepare for a test? The day, the time, is the person giving a choice of location of where they're going to get it? What is this test going to do? And some of the situations where, why am I getting a test for something that I'm asymptomatic about? I don't have any problems. I don't think I need a colonoscopy. I don't think that I need to go to the dentist. I don't have dental pain. Those are real issues of trying to convince folks from either other cultures or maybe third or fourth generation here in the U.S. to understand really the benefit of screening, even though it's a disease where they have no symptoms, and having them explain it, no symptoms yet. Looking at prescription and non-prescription and the health information related to what does it mean, I think pharmacy has done very, very well at making their prescriptions much clearer to understand. It's not QID anymore or TID like it was before. It's now take one pill 3 times a day and it's really written out. And making sure that they understand that if they have any questions, they can ask the pharmacist. Pharmacists happen to be my favorite part of the healthcare system because they have no copay or co-percent. They have no appointments. They're always available on Sunday when you go to the grocery store to ask a question, and they're going to direct you to the right spot or answer your question if you can, if they know the answer. And so also teaching patients to think about the evidence-based practice. This is more for the health navigator, perhaps, than for their patient or client, but really have them be thinking, okay, what is behind this? And they're not going to go into, you know, reading the journal articles, although they could, and they should be exposed to how to do that, but to really learn from each of their patients so that they're better health navigators for the next patient and to be accurate in the information that they're getting. And then, of course, the ever-present electronic medical records, and those are very cryptic. If you have not had the opportunity to actually look at what it looks like, it's very much a point-and-click system. So it cuts down tremendously on the typing, but it also cuts down on the cryptic notes that are available. And if a health navigator is following a patient in the hospital or is working in a hospital and looking at electronic medical records, they really need to be familiar with the abbreviations and the medical terminology and how to navigate through a healthcare record. It is not like the old patient charts where you flip to the lab tab and you get today's chart information. It's different than that, and they need to be taught how to do that. So this is a high level. This is the last slide. So now we're going to move into just one slide here about linking the two, community colleges and health navigation. Community colleges make a tremendous difference. I always give a talk at graduation here in the College of Public Health to the undergrads, and I remind them that only 26% of adults in the United States have an undergrad degree. That is always shocking to them. Well, only 3% have a master's degree. So we need to take a step back and see the value of the community colleges. You are the pipeline to career ladders. You're the pipeline to perhaps a university at some point for these students when finances and life circumstances allow that to happen. But we also see that community colleges are going to be the basis for the health navigation, and that's going to make a difference in the health of the communities, not only in the health of the community colleges, but also the health of the communities of which these folks live in. So from that, we will go to questions, and I will have Sophie come back on and explain once again how to ask questions if you have any, either by voice or by chat. Thank you very much.
Great, thank you so much, Kay. And yeah, if you have a question, we very much encourage you to voice your question out loud. The other thing I would remind you is that we do have Dr. Richard Riegelman in the audience listening as well. He is very involved in this initiative, and so he's also available to answer questions. But I will go right to the questions in the Q&A. Someone is asking about Bachelor of Science public programs. What about Bachelor of Science public programs that want to offer a navigation program, for example, a minor, in partnership with our pharmacy, social work, nursing, PT, OT, et cetera? What advice for colleges of health science that have an interdisciplinary educational model?
I would highly encourage it. I think that we have got so much work to do in healthcare that it doesn't really, it's not limited to a community college, and it could certainly be a minor in other, in like an undergrad degree, kind of like I mentioned for the community college. It could be a certificate, it could be a minor, and it's really increasing awareness of good care. And I don't think that a lot of other programs go into the depth of the health literacy and the cultural and the social norms and aspects, and just being more aware of those kinds of things. So I would say absolutely, go for it.
Great. Okay. Another question about long-term care. Is that a topic also covered in the book?
Yes, long-term care is, there's a whole section on long-term care, and all of the choices from the advantages and disadvantages of caring for loved ones at home, using a model of going into an assisted living facility, what kinds of things to look for, when it becomes dangerous maybe due to lack of skill of the caregiver at home. You know, I live in Florida. We're surrounded by elderly people, and one of the things that is mentioned in the book is at what point does the caregiver become the patient, and when the patient is no longer the patient, and now you have two patients and maybe a half of a caregiver. So we look at all kinds of different options as to how families struggle, not only with the tremendous cost, but the emotional and really difficult decisions on how to care for each other.
Great, thank you. Could you address professional credentials? For example, does a nationally recognized certification exist for health navigators?
It is on its way. There is a group in New York that is putting together a health navigation certificate program. That's supposed to be available in fall of 16, so we're about as in fall of 16, I think, as possible. And so I recently looked it up, and they're not there yet, but it is coming, and I think that that's going to be very, very advantageous. It's going to give health navigators a baseline nationwide with all of the different topics and titles that we talked about, that everybody will agree that this is the minimum standard of care, just like nursing, just like any other certificate program. So I think that that will help.
Great. I've got some more questions coming through in both the chat and the Q&A, but before I read those out, Erica, are you on the line, and do we have any questions coming through on the line?
We have a question from Maureen Edwards.
Hi, this is Maureen Edwards. I'm calling from Montgomery College in Rockville, Maryland. And mine is a curriculum question, but I think with credentials you've touched on it. I was wondering if you foresee a national curriculum, or at least suggestions for a national curriculum, or is it going to be state by state? I've started looking into it, and it seems a bit like the Wild West out there. I don't know if there are held to standards yet.
You're right on all counts. It is the Wild West. Everybody has different opinions about what a health navigator should be, and everything from a master's level nurse, I've been told that by a hospital administrator, that no one else could do this except for a master's level nurse, all the way down to Why, of course, a certified nursing assistant could do this in her own neighborhood because she has the advantage of having the language and the culture. So you're absolutely right, and I think that the baseline certification will at least pull in a little bit as far as we'll go with the baseline. I also see that nurses may choose to do this as a add-on because they choose to, or because their school offers it, but we'll have to wait and see how that plays out.
Do you see this, Kay, being built into a community health program?
Yes, absolutely. That's exactly where I see it, because they're going to understand the community, and just stepping into a community, as unfortunately universities are guilty of too often, and saying, we are from the university and we're going to tell you what you need. And, you know, we do focus groups and that kind of stuff, but it needs to come from the grassroots up. So I think that the Insurance Health Navigator of the Affordable Care Act has already taken that first step for us.
Thank you.
Thank you.
Great. Several questions coming through about certification, which I think you may have covered. One question asking, and I'm not sure if this is a sort of a refinement of what you just answered, Kay, but is there a certificate level of Health Navigator?
Not yet. We'll get there.
Okay. And is there, from the same person also asking, is there a pathway for patient care technician to move into this career?
See, that's exactly where I see the first step of this going is I love patient tech folks. I love them. They're the ones that are spending more time with the patient because they have to take their blood pressure and, you know, all those things 2 or 3 times a day. They're in the room a lot. This is the new name for the certified nursing assistant, or at least a step up, I think, in most places it is here in Florida. These are the folks that I think would be the perfect health navigator. They are a little bit older. They've taken care of a wide variety of people. They, I'm sure, have taken care of patients who have been readmitted, who have fallen at home, who did not have the support at home that they need. Patient techs also frequently might do some one-on-one care for patients in the hospital. So if I were to pick something, a career that would be the next step up, it would be the certified nursing assistants and the hospital patient techs that could then go back to the community college and move one notch up on the career path, because these folks really get it. They have taken care of people through COPD, through death and dying, through cancer, through chemo, through many hospitalizations, and they really, really, truly get what's going on at home and with the caregiver and the stress of taking care of people.
Thank you. Can you recommend good health navigation certificate programs to look at?
There's a whole host of other types of certificates out there. There is now the wellness coach, the health coach, a lot of fill in the blank with the word coach at the end. That is really not my definition or the overview of the book's definition of a health navigator. So if you Google health coach or health navigator, you're going to see everything from come to the Holiday Inn for 3 nights next week and you're going to get a certificate, all the way to the wellness coach program that Duke University has, which is 400 and 500 hours of one-on-one training and 2 or 3 weeks on the campus of Duke University. So when you Google it, it is everywhere, and not always at the quality that we would want to see. So I would caution you to, well, I would encourage you to Google it, and just see how many things are out there, and then you will recognize good quality when you see it.
Great, thank you, Kay. I've got 7 or 8 more questions here in the Q&A box, but I don't want to ignore people that are wanting to voice their question. Erica, do we have anyone else on the line to ask a question?
We have a question from Kim Davey.
Hi, Kay. My name is Kim Davey. I'm from Stanford University in Birmingham, Alabama, and I'd posed the questions about interprofessional models and then credentialing, et cetera. But I had a question about, I agree with the caller that it feels really like the wild, wild west. And in the state of Alabama, we obviously have we're riddled with health problems that stem from those social and economic determinants. I was wondering if you, in looking at these programs, have seen a good model for those practical experiences for students. Is there a practicum component that you think is important to these programs? Just your thoughts on the practical experiences for people who may be entering this as a foray into a new area and trying to get them some of that experience if they haven't yet had that.
I agree 100%. This is not the type of degree that you would go into without having some real hands-on. And the easiest way, I think, off the top of my head, that would solve this is I would highly recommend that students volunteer at a hospital. They have to see, feel, taste, touch, and really understand what, for lack of a better phrase, what sick people look like. I mean, if this is somebody who still has all of their grandparents and all of their aunts and uncles and no one's ever been sick and they've never been to a funeral and they've never been involved in a chronic disease, really they have absolutely no idea. And so I would highly recommend that they could even deliver flowers and mail at a hospital and get a really good sense of what it is that people and hospitals, and is this really the environment that you're comfortable in? That's where I would start, and then perhaps also having them volunteer in a nursing home or an assisted living, or if they're really ready for it, not for everyone, but ready for it, is to volunteer for hospice. They have got to see that it's not going to the urgent care and seeing little sick kids. This is chronic disease, and they have to be able to understand that this is somewhere that they have a comfort level to go into people's homes and to work with patients who are sick. And as we all know, patients who are sick are also coming with a high degree of grumpy, angry, depressed, and they're always not nice. So they have to realize that this is a challenging but very rewarding and necessary job.
Thank you, Kay. And your book was just sort of got to a heart and just touched me, especially looking at working in our state and the intense needs we have. So thank you.
Thank you.
Thank you both. Another question about salaries. What are the salaries that a health navigator can expect?
Well, I can only speak for Tampa. We have the Insurance Health Navigator program housed here at the College of Public Health, and those health navigators make between $30,000 and $35,000.
Okay. Is someone asking about the other textbooks in the health navigation series that were mentioned at the beginning of the presentation? I can tell you we have 2 more coming out in the spring. One is Navigating the U.S. Healthcare System, and that's by Nancy Nile, who authors another text on the U.S. healthcare system for Jones Bartlett. And then the second text is on navigating health insurance. And I will put up on screen on the last slide, we do have a website, healthnavigationseries.com, that lists out all of those texts with information on how to get review copies if you'd like to get review copies. Let's see, would you recommend having a certificate as a patient navigator after having an MPH?
Yeah, I see that question, and I would say yes. And the reason that I say yes to that is I have an MPH, I am a nurse, and I think that there is still even more to learn. It's different to be a patient navigator. Your public health and MPH folks work at the population level. Patient navigators work at the individual patient level, but they still have all of that rich and valuable experience from their MPH about social determinants and health navigation and electronic medical records, but they really don't usually work one-on-one. And we all, at some point in our life, will probably either be a health navigator for friends and family and relatives, or we will be the person who needs a health navigator. So I just think you can never get enough information about health care to help yourself and help others.
Thank you, Kay. I think we may have Dr. Riegelman on the line. Go ahead, Dr. Riegel.
Hi. I didn't really have a question, but I did want to make a few comments. What Kay has been talking about really is critical as an entry point into health navigation. And I think you'll find that those of you who are in nursing, health professions, health sciences, that this is an excellent text to use for the first course. And for those who are thinking about having programs, this is a great way to test the waters, because this book covers the full range of subjects and gets people's feet wet, and you'll see from there what kind of a interest and what kind of an audience you have. In addition, you should look at the Community College and Public Health report that was put out by the League for Innovation in the Community Colleges and the Association of Schools and Programs of Public Health. And that report, as well as a guide, is available on the League's website, league.org/CCPH. And this guide does outline the recommendations for health navigation programs, and it gives a full sequence of courses that are one way to do this. Let me make just a couple of points about the recommendations that the League made. One is the issue that was raised about practicums is critical. Experiential learning was strongly recommended as a element of all health navigation programs, as well as public health programs in community colleges, so that people can really get a chance to see what the field looks like in the field. And this is a great way to get people launched on their careers as well. So the practicums are a critical component. Secondly, there is an interest in the Society for Public Health Education, SOPHE, who represent the health educator specialist programs that are bachelor's degree programs as well as master's degree programs in transferring health navigation programs to health education. So one of the issues that is sometimes raised is what are the career opportunities beyond the associate degree level, and one option for this is to transfer to bachelor's degree programs in health education. So as Kay has suggested, this is a field that is going through tremendous change, tremendous growth, and it's how things are going to eventually come out is obviously not clear yet. But Kay's book represents a solid foundation that allows for growth in a lot of different directions. So I think you'll find it's a great way to begin, and hopefully you'll take a look at the other books that are coming out in the series in the spring.
Thanks, Dick.
Thank you.
It's nice to have you on the call.
Thank you.
Thank you very much. And again, that's Dr. Richard Riegelman. He is the series editor of our health navigation series, and he's also the series editor for our essential public health series, and he's been very much involved in this initiative with the community colleges, the League, and ASPPH. And I think you may have just answered, Dr. Riegelman, a question that just came through on the articulation into bachelor's degree programs, but someone is asking, after the creation of a health navigation or community health program at the community college level, what would the most appropriate program for articulation into a bachelor's degree program be? A social welfare or public health?
I can answer that because we're doing it at Hillsborough Community College right down the street from my building. And what we're doing is a 2+2 program in which we overlap and share credits on 6 credits. And it also allows the students, which I think is working very well, is that if they want to take those 6 credits on the university campus or on the community college campus, then when they transfer to the university campus, they're slightly more familiar and it's not so scary as moving from the smaller community college to the university campus.
Great, thank you, Kay. We have another question about accreditation. Are there any national organizations that could accredit a certificate program?
Well, for those of you who might have been at APHA, and I was at the Jones Bartlett booth, we spent a lot of time talking about that and didn't come up with any conclusions except for the fact that we really think that it is necessary to have continuing education, not only for folks that will at some point have a certificate in health navigation, but it might work out well for nursing and other fields. So it's in the works. Like Dr. Riegelman said, we are probably about 6 or 8 blocks behind the starting line, but we're going to be at the starting line and we're going to make it happen. So it'll take everybody's input on how this is going to unfold and be standardized nationwide.
Great, thank you, Kay. I have 3 or 4 more questions here. I just want to mention we are coming up on the hour, and if everyone's happy to hang on for a few more moments, we can answer those questions. If you do have to drop off, I have put up on screen here contact information for both myself as well as Kay. If you have further questions, please don't hesitate to reach out to either one of us if it's about the series or how to get a copy of the book or anything to do with the book itself in terms of instructor materials, et cetera. Please don't hesitate to contact me. And then further questions about health navigation programs or content in the book, Dr. Perrin is happy to answer your questions. And I also encourage you to visit www.healthnavigationseries.com. The report that Dr. Riegelman mentioned, the PDF report from the League and ASPPH is available on that website, as well as links to Kay's blog post and some other resources are available there, as well as information on how to get complimentary review copies. So with that, I'll just switch back now to questions because we do have a few more. And Kay, if you can hang on for a few more minutes, we can go through those questions. Is there an apprenticeship model for this program?
Not yet. A great idea. I would see that this would be perhaps not in the hospital setting, but perhaps more in the assisted living, hospice, long-term care facility. Great idea. As far as I'm concerned, all ideas are great in this because it's so much fun to just be right there developing it, and all ideas are welcome and encouraged.
Great, thank you. This question, I think we may have partly answered this already. We would like to offer a health and wellness program and will incorporate the role of the community health worker and health navigator. What baccalaureate degree can this lead to?
I would, because I'm biased, I would say public health, because you're going to get the information of prevention and looking at the whole community, at the whole population, And then the Health Navigator piece is going to take it down to the individual level to be that liaison of understanding and compliance to do the prevention of all the chronic diseases that we're dealing with on a daily basis in the United States, actually globally now.
Great, thank you. Is there a path for medical assistance?
Yeah, I saw that question. I like that question, Rita, wherever you are. Thank you for that question. I see medical assistance exactly the way I talked about nursing assistants and patient techs. Medical assistants normally work in doctors' offices and clinics, and like my comments before, they are seeing the patient and the family and the caregiver over and over and over, and they really see where they're struggling. Did they come back because they didn't take the medication? They took it wrong. They missed an appointment. They missed the screening test. Why? They will understand why, because they know the family and they know that patient that's coming back week after week after week after riding a bus or coming by taxi and all those other complicated factors. Excellent point. In fact, until that question, I really hadn't thought of the value of the career path of health navigation for medical assistance. Very, very good question.
Great, thank you. Well, that actually wraps it up for the questions. So I will just once again point to the Health Navigation Series website. I very much encourage you to visit that if you'd like more information or to request a copy of the book. Please feel free to visit or reach out to either one of us. And at this point, if there are no further questions, thank you so much to everyone for your wonderful questions and comments today, and a very special thank you to you, Kay, for your presentation.
Thank you, and thanks for everybody, and be sure to email me and tell me what's going on and what's working, and more importantly, what's not working, so we all learn from each other.
Thank you, Kay. Thank you so much, everyone. Erica, if I could ask you to go ahead and close out the line, that would be great.